try to write for the next hour.
Okay,
Fast.
you can do it.
Like a
I
lot
have
of-
saved.
Whoa.
I have saved.
Okay. Charlie.
This meeting is being recorded.
So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. Please note for the record, Karen San-Hilaire is representing Mary Wasser Park in a voting capacity. So I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on September 9th, 2024. Dr. Katz,
Yes.
Sally Hernandez Piñero,
Yes.
Karen San-Hilaire.
Yes.
So the minutes are adopted. Thank you. Next, we will hear the Vice President's report, Mr. Saiz. Okay, so I'll leave that at the end. Okay. So we have a number of action items to consider, so let's get started.
Great. I'm Deborah Morris, Senior Director for Real Estate and Housing, and I will read in the resolution for the Bellevue Daycare System. Authorizing New York City Health and Hospitals Corporation, the system, to execute a revocable license agreement with Bellevue Daycare Center, Inc., BDCC, for approximately 3,661 square feet on the first floor of New York City Health and Hospitals Bellevue, and the use of the outdoor playground within Bellevue's First Avenue Garden, in which to operate a licensed child care center for Bellevue staff and the community for a term of 5 years with the occupancy fee waived. I'm going to turn this over to Arcia.
Good morning. Affordable childcare, as you know, is a national challenge, especially for low-income families. Childcare is important to our workforce at Bellevue Hospital and also the Kips Bay community. The Bellevue Daycare Center is well established and is conveniently located on campus at Bellevue and has been in existence for 50 years. The Bellevue Daycare Center currently offers 33 childcare spots, and we have just expanded and will go to 42 slots. The daycare center prioritizes Bellevue staff to target at least 51% enrollment. They offer services for infants and toddlers ages 6 months to 3 years and preschool 3 months to 4 years. The program is regulated by the DOE, who manages the preschool enrollment. Next slide. The Bellevue Daycare Center seeks to maintain affordable tuition. They offer below market rates to both Bellevue staff and the Kips Bay community. They also support the Bellevue staff in obtaining additional financial assistance through New York City's Administration for Children's Services, New York State facilitated enrollment subsidies, and other union incentives.
Next slide.
Next slide.
So this is the existing space at the daycare plus an expanded 630 square feet they are requesting on the first floor of the administration building. The existing space and expansion space are not readily convertible into patient care space, and the cost of construction is funded by New York City Council to the Bellevue Daycare Center. Next slide. These are the license terms. 5 years terminable by either party, 30 days notice without cause. Its location is 3,661 square feet on the first floor of Administration C and D building of New York City Health and Hospitals Bellevue, and the use of the outdoor playground that's within Bellevue's First Avenue Garden. The hours of operation are 8 a.m. to 5:45 p.m., and the occupancy fee is waived for the benefit conferred on staff having access to affordable, convenient, and discounted childcare, with the prioritization of Bellevue staff to fill at least 51% of the infant and toddler program slots. And next slide is the resolution that I've already read in.
Thank you so much.
Please let me know if you have any questions.
Any questions?
Quick questions, I swear. If we, is the 51% minimum Bellevue a legal requirement or programmatic?
It's legal based on the agreement, but it's not for the Department of Education section. You have to apply through Department of Education to get to the pre-K school. However, if your child is enrolled as an infant or toddler, they will save a space for you in the Department of Health regulated space.
And I have to say, without getting into a long discussion about it, the rates are not affordable to low income. I mean, it just isn't. But they are what they are to carry the program, I imagine.
Yes, but with the subsidy, Bellevue staff pay as little as $22 per month. They work with each and every family, and it's all based on the poverty levels.
Right.
And people, the average rate that the employees pay, as I said, is between 22 and maybe $200. Yeah.
Do you help the community members as well?
We do help the community members as well because these subsidies are available for all the citizens of the city.
Okay, thank you.
Thank you. Okay, let me take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution is approved. Thank you so much.
Thank you.
Thank you.
Uh,
Okay. So this is a lease for the Gotham Health Lefrak Clinic at 5917 Jefferson Boulevard, as well as a sublease for a portion of the space to Pediatric Specialties of Queens. I'm Deborah Morris, and we're joined by Ted Long, Senior Vice President of Ambulatory Care. Let me read in the resolution, the two resolutions. So the first resolution, authorizing New York City Health and Hospitals Corporation to execute a renewal lease of LSS Leasing Limited Liability Company, the landlord, for approximately 5,120 square feet on the ground floor of 5917 Junction Boulevard, Corona, New York, the premises, to house the Women's Medical Center at the center, operated by New York City Health and Hospitals Gotham Health, Gotham, for an initial term of 15 years, with the system holding 2 5-year options to extend the lease at an initial rent of $62.50 a square foot, to increase annually at 3% for an annual rent of $320,000 and a total rent over the potential term of 25 years of $11,666,965. Now I will read in the resolution for the sublease to the subtenant. Authorizing New York City Health and Hospitals Corporation, the system, to execute a renewal sublease with the Pediatric Specialties of Queens, PC, the PC, for approximately 2,457 square feet on the ground floor of 5917 Junction Boulevard, Corona, New York, the premises, in which the PC will continue to operate a pediatric medicine practice co-located within the Women's Medical Center, the center, operated by New York City Health and Hospitals Gotham Health, for an initial term of 7.5 years at an initial rent of $64 a square foot, to increase annually at 3% for an initial annual rent of $157,248, provided the PC shall have an option to extend the term of the sublease by another 7.5 years, and provided further, the system shall hold an option to take back up to 25% of the area subleased to the PC on 1 year's prior notice, and with a corresponding reduction in the sublease rent payable by the PC, with a total sublease rent over the maximum potential 15-year term of $2,924,642. Gotham Health Lefrak. The building location is 5,124 feet within a large commercial building. It's well located, and Lefrak has been offering primary services since 2000, initially operating under Elmhurst Hospital. I'll turn it over to Ted.
Okay, so thank you for having us today. What I wanted to do today is tell you a little bit about this clinic, what makes it special, and what we understand the community needs to be specific to this area, and and why the clinic services are especially important. So, as Deborah said, we've been operating this clinic since the year 2000, so it's been about 24 years it's been in existence. What's special about it is it offers the continuum of care. So the clinic that we run provides women's health care, prenatal care, so having a family-oriented approach. And then that transitions into the pediatric care that's offered on the same floor of the building. So you can imagine a family with a young mother may receive prenatal care from us, women's health from us, and then can walk down the hallway to start receiving pediatric care for her new child. Next slide. So in terms of the needs of the community, this is Queens. We currently have 8 sites in Queens. And if you want to go to the next slide, we can zoom in on some of the unique health needs of the community where this clinic is in. So in this particular area, the rate of expectant mothers receiving late or no prenatal care is higher than the citywide average. Also in this community, the teen birth rate is higher than citywide average too. In terms of care that kids are receiving, it's especially important because 1 in 4 kids have childhood obesity in this neighborhood, and that's higher than citywide average too. In terms of other ways to look at need, 33% of the adults in this neighborhood are uninsured, which is higher than the rest of New York City. And only 68% of residents in this neighborhood rate their health at the level where we want it to be. We want it to be 82%. So all told, there's a clear need in this community for ongoing family-oriented care, starting with the women's health care and prenatal care that we offer, transitioning into the pediatric care that's been offered in the continuum with us for 24 years in the pediatric specialty clinic on the same floor.
Next slide, or should we pause, Calicia?
But-
Okay. Okay.
Thank you. To say a couple more words about the clinic, it serves nearly 1,600 patients each year, and the vast majority of them, 95% plus, 96%, are women. So just speaking to the need to have women's health provided in our clinic, transitioning to pediatrics in terms of the subtenant that we have a great relationship with. So if you want to go to the next slide,
So
get
here
to the
we-
lease terms.
Here we have the lease term. Gotham Lefrak will continue to occupy 52% of the space, which we showed you earlier. It's a 15-year lease with 2 5-year options for renewal to commence upon execution. The base rent is fair market value at $62.50 a square foot to escalate 3% per year at 15 years. First year rent will be $320,000, which is $26,666.70 a month. Gotham's responsible for operating expenses, including water, electricity. As part of the renewal, the landlord's going to make improvements, including replacing the HVAC system and the building entry system at their cost. Any increases in property taxes are billed as additional rent. The last 2 years, there was no increase. So total annual occupancy fee over the potential 25 years will be $11,666,965. Next, we'll talk about the subtenant Pediatric Specialties of Queens. Ted.
So as I was saying, this is the latter part of the family organization.
Ted, I'm sorry to interrupt, but I was just channeling Frida for a moment on the rent, on the property tax.
Yes.
If she were here, she would say, don't we sometimes make arrangements because
Right.
of a public entity and therefore they don't have to pay? Is that not viable here?
Absolutely. So we do prefer to do that. This building is located within the Lefrak commercial and residential complex, and the building ownership is unwilling to make a condo for us so that we could make that, so that we could take no taxes and be exempt. It's a sort of a preferential tax relationship for us and unpreferential for us, but we requested it and they were unwilling to make that.
Does it hurt them? Just to teach us something? What is it that it's
So
hard
they
to
can
do?
charge the taxes against their losses. It's a preferential thing to them to have taxes billed.
I think also it's a legal expense. I would have to create a condominium structure. And
I
if they
see.
choose not to do it, then that's
Nice.
in their choice. I mean, I'm sure our lawyer could elaborate more, but I think they have to make a condominium. If they don't want to do it, then
They are unwilling to do it for any of their public tenants, of which there are many.
I see.
So we actually had a long conversation about it. So it's a portfolio management decision on their part.
I see. All right.
But that would also be extra cost for us, so it may balance out in some ways.
So it looks like no.
No.
But there's
no,
nothing we can
no,
do.
no,
It sounds
no.
like nice try.
It is a cost to us, but it's the benefit is we get to be in a prime location in a space that's actually quite well maintained. It's truly one of our nicer spaces, and they are making substantial improvements with execution of this new lease. So there's sort of a trade-off there.
So to go into just the overview of the clinical features of this, so again, we provide the women's health and prenatal care, and then families can transition to receiving pediatric care in the same hallway. So we are able to help our patients by giving them family-oriented care across the building, but also the pediatric specialties of Queens Clinic, while providing pediatric primary care, can refer back to us both at Gotham and at Health and Hospitals in general for any needed specialty care going forward too. Should also say that Dr. Villegas was Elmer's trained physician, has been in the building with the relationship we have with them with this continuum of care since we started the clinic 24 years ago.
Next slide.
I'm sorry, is this a private business?
Yeah.
Okay.
So again, this is how the space divides between the Gotham Clinic and Pediatric Specialties. Pediatric Specialties is just slightly less than half the space. Sublease terms, next slide. So Pediatric Specialty of Queens will continue to occupy 48% of the total 5,120 square feet, which is about 2,457 square feet. The term is a 7.5-year sublease with one option for a 7.5-year renewal. The base rent is fair market value, $64 a square foot to escalate 3% each year for 7.5 years. The first year's rent will be $157,248, which is $13,104 a month. Gotham has the option with 12, or the system has the option with 12 months' notice to recapture up to 25% of the sublease space. The subtenant is responsible for 48% of other occupancies costs, such as electricity and maintenance, and 48% of increases in property taxes will be billed as additional rent. So making the total potential value over 15 years up to $2,924,642. Next slide is the resolution, which I've already written. Any questions?
Yeah, please.
I have some questions on these and subsequent matters, but they're not gonna affect my vote or the resolution, so I'll just ask them separately, okay?
Okay, thank you. Anything else? Okay, then all in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you.
It's two resolutions, so you need to vote on both.
I'm sorry, let me count the vote. So let's take a vote on the first resolution, which is the
Prime lease.
the prime lease. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. And the second one is the sublease. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Thank you. Okay, next item, I'm joined by Svetlana, CEO of South Brooklyn Health. So resolution authorizing the system of New York City Health and Hospitals Corporation, the system, to sign a 10-year lease with ACE 3003 Avenue L LLC, the landlord, for approximately 1,200 square feet of ground floor space at 1902 Flatbush Avenue, Brooklyn, to operate a supplemental food program for women, infants, children, the WIC program, managed by New York City Health and Hospitals South Brooklyn Health, South Brooklyn, at a rent of $54,000 per year or $45 per square foot, to be escalated by 2.5% per year, that is payable only after 2 months at no rent, with an option to terminate after 5 years, exercisable only by the system if the WIC program funding is discontinued, provided the system makes a termination payment of 3 months' rent on termination, and with a further option held by the system to renew the lease for an additional 5 years for a total rent of $968,324, due over the potential 15-year term. Next slide. The WIC program provides nutrition services to pregnant, breastfeeding, and postpartum women, infants, and children less than 5 years of age. South Brooklyn has been assigned to serve in zip code 11210 starting in 2023. South Brooklyn currently operates the WIC program at another site nearby and is proposing to move the program to this new space. South Brooklyn identified this space to better meet the program's needs, and New York City Department of Health has approved the use of this site for the WIC program. You can see on the map the prior location and the new location and their close proximity. The lease terms: New York City Health and Hospital will occupy 1,200 square feet at 1902 Flatbush Avenue. It's a 10-year lease, which will commence on execution. The base rent is $45 a square foot to escalate at 2.5% per year. The system gets 2 months of the lease term rent-free, and the system will hold an option to terminate the lease at the end of the 5th year if DOH WIC program grant is not continued. To exercise the termination option, the system will pay a termination fee equal to 3 months' rent. As a condition of occupancy, the landlord will provide ADA access, and the total occupancy fee for base rent over the 15-year term will be $959,324. Please let me know if you have any questions, and this is the resolution, which I already read in. Myself or
Any
Svetlana.
questions from committee members?
I have a question, probably best to Svetlana. From a mission point of view, so this is all good. I have no problem with the lease. What is the argument for WIC programs being run by us versus the CBO? No question, WIC is a very important, useful program. Some of them in the city we run as a hospital. You're not the only one, but why do we run them?
Partially because we're servicing our own patients, partially because this might be an opportunity for us to have actual physicians co-located within the community. Could a CBO run it? Yes. I mean, clearly
they
they're
do.
doing it successfully. At the end of the day, this particular program is fully funded by the grant, so it actually is no net additional dollars coming out of our pockets. And with the ability to break the lease at 5 years, so we're not tied in if we don't get a grant renewal. But you couldn't make the argument either way. I think as long as the community is actually getting the service,
Sure.
then that is the most important part. But from my point of view, I actually think this might be an opportunity for us in the longer term to co-locate a primary care service within that community. So that really would be the only thing. We
There's
have
no
experience
cross
doing it.
subsidy.
There is no cross subsidy. It's just the money that we're getting is just paying for the WIC program. So we're not actually making any money off of it. We have experience running it. We've been doing it well. This is our third site. And so we really feel passionate that the patients receive the care. But if a CBO wanted to run it, as long as that service was available, it would be fine. So we're some potential kind of cross-pollination of some of our clinical services, but that's about it.
Right. I mean, I think it's always worth thinking about, what is synergistic to our mission, and what is something that someone else could do as well, better or not better. That's right. Again, this is nothing about WIC, which is incredibly useful. It's just a question of, are we the sensible people? If there's no, if there's no cross subsidy, and at least some of these programs exist as sort of independent satellites, it sort of seems like, gee, it could be run by anyone.
I mean, frankly, if we weren't doing it really well, then I would completely agree with you. In this particular case, we have some strong leadership for WIC. It's a tightly run program for us. So it's not actually, we're not cross-subsidizing. It's not costing us anything. And so we've agreed to run the third. I don't know that we would do a fourth. I think this is probably it for us.
Okay, this is helpful to hear.
Okay, so I'm gonna ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much. Manny, your turn now.
Thank you.
Okay, good morning, everybody. This resolution is authorizing New York City Health and Hospitals Corporation to further increase the funding by $8 million for its previously executed contract with Array Architects for architectural/engineering services for the renovation of spaces at NYC Health and Hospitals Bellevue and NYC Health and Hospitals Woodhall that began in June 2020 in connection with the system's correctional health services, an initiative to treat its patients who require higher levels of care in its outposted therapeutic housing units, which follows previously funded increases of $1,814,880 authorized in November 2021 and $6,409,289 in November 2022, $1,960,238 in May of 2023, $3,477,599 in November of 2023, such that funding is increased by $22,325,006 to a total not to exceed the sum of $30,325,006, and to extend the contract by 3 years to November 30th, 2028, with anticipated construction completion of December 2027. And with that, I'll hand it over to Menji, who will work us through the contract history and the.
Good morning, thank you. So currently we have a contract with Array Architects for design and engineering services for both Bellevue Hospital and Woodhull Hospital OTX-HU program. The contract term is currently 5 years. It started on December 1st, 2020, and is set to expire on November 30th of 2025. We have a table here showing all the previous amendments that the board approved. As Manny mentioned in the resolution, as you can see, we have 4 actions that brought the NTE to $22 million. To Tim and Carrie from CHS.
On March 4th, the mayor directed Health and Hospitals to move forward with construction of outposted at both Woodhull and NCP. New requirements for security operations necessitate a 90% redesign of Woodhull's 9th and 10th floors, predominantly to incorporate the Bellevue design changes for security. Funding for these new requirements have been funded in the September capital plan by OMB, and construction of Woodhull OTX-HU is anticipated to begin in fall 2025 and be completed by December 2027.
Next slide. So this is the request to increase the contract amount for Array Architects by $8 million to a total NTE of $30,325,006 and extend the contract by 3 years to November 30th, 2028. The vendor performance has been good to date. All funding has been provided by OMB in the September capital plan, and CP is being prepared to be submitted to OMB. Happy to take any questions.
I just have a quick
Yep.
question. I promised I wouldn't ask, but this one makes me
Go ahead.
crazy, so I have to say something. We are going from 8,600,000 for architectural and engineering services, up to 22 million now. Is that right?
22 million to 30 million, increasing by 8 million.
My favorite project and my least favorite project. Okay, thank you.
Okay, so let me take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Okay, the resolution approved. Thank you. Let's move to the next one.
Okay, the next resolution is authorizing New York City Health and Hospitals Corporation to execute a contract for 3 years with a 2 one-year renewal options for Michael Cooling to undertake essential preventive maintenance and repair services of refrigeration and related cooling equipment for a contract amount of $6,668,810 with a 20% contingency of $1,333,762 and an emergency repair allowance of $666,881 to bring the total cost not to exceed to $8,669,454. A little bit on the background here, these services provide refrigeration, freezers, AC, and ice machines, which are critical to our clinical environment and adhere to all refrigeration and HVAC hospital regulations. The contract includes PM, labor, and emergency repair with an annual spend of $1.2 million. Vendor will provide services of full-time technicians to the following locations: Bellevue, Harlem, Queens, and Lincoln. And vendor will assume preventative maintenance responsibility for all equipment for all 4 sites, including inspection and testing. And vendor will also provide refrigeration repair as needed in other H&H locations. And with that, I'll hand it over to Mendy for the procurement.
Thank you. This is our standard procurement, minimum criteria, substantive criteria. The evaluation committee were made up of our director of engineering and senior stationary engineers, who are the folks primarily responsible for the equipment in this contract. Next slide. This is an overview of the procurement. So back in August of 23, we issued an application for RFP, which was approved by CRC. The RFP was posted to City Record in June. We conducted walkthroughs and pre-proposal conference. 6 vendors attended the pre-proposal conference. 2 proposals were received in July of 24. The evaluation committee scored the proposals in August, and Michael was selected as the top scoring proposer. Next slide. Vendor performance to date has been excellent. Next slide. This is the contract budget. Labor $6.6 million over 5 years with contingency and emergency repairs for a total of $8.6 million. Next slide. And this is the request to enter into contract with Michael, who is a certified WBE, for $6.6 million for a contract with an initial term of 3 years and 2 one-year options starting in January of 2025. Thank you, and happy to take any questions.
Any questions, Michael? Hearing none, let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Let's move to the next 3 resolutions go
Okay.
together.
Thank you. This will be 3 resolutions in this one presentation. This authorizing New York City Health and Hospitals Corporation to execute a contract of 3 years with 2 one-year renewal options for Carrier Corporation to provide HVAC, chiller preventive maintenance, and repair services at several acute hospitals for a contract amount of $1,869,290 with a 20% contingency of $373,858 to bring the total cost not to exceed to $2,243,147. Authorizing New York City Health and Hospitals Corporation to execute a contract for 3 years with 2 one-year renewal options for Johnson Controls to provide HVAC, chiller preventative maintenance, and repair services at several acute hospitals for a contract amount of $4,626,212 with a 20% contingency of $925,242 to bring the total cost not to exceed to $5,551,454. And then finally, authorizing New York City Health and Hospitals Corporation to execute a contract for 3 years with 2 one-year renewal options for Train US Inc. to provide HVAC, chiller preventive maintenance, and repair services at several acute hospitals for a contract amount of $1,523,691 with a 20% contingency of $304,738 to bring the total cost not to exceed to $1,828,429. A little bit of the background here, the system critically has 110 chillers and HVAC equipment under several maintenance contracts with Carrier. Chillers serve as the cooling source for most of our facilities at New York City Health and Hospitals. The current spend for maintenance services over the 5-year term is $5 million. Repair spend is averaged on $92,500. A 5-year best interest extension was with an expected spend of $739,000, has been executed in order for the RFP process, internal approvals, and the contracting process to be completed. The extension term is from November 1st, 2024 to March 31st of 2024. Wrapping up the background, the system has a single vendor for this work for many, many years. Due to the nature of this equipment, one vendor is unable to provide us timely and cost-effective services for the equipment which are not under an OEM manufacturer. Having the OEM manufacturer manages the preventive maintenance program and repairs for the respective equipment would be the best for the system, and our equipment was broken up into 5 equipment groups by manufacturer type. And with that, I'll hand it over to Mentor for Procurement.
Thank you. So, quick overview. Back in July of 23, we received approval from CRC to issue an RFP for this for these services. It was posted to City Record. After reviewing with our evaluation committee, who are made up of our senior chief engineers, folks that are primarily responsible for managing this equipment, they made a decision to split it into the 5 equipment groups. Pre-proposal conference was held. 9 vendors attended. 5 proposals were received, and as you can see, the evaluation committee awarded each equipment group to the vendor listed next to it. So equipment group 1 to Carrier, number 2 to JCI, 3 to Train, and then 4 and 5 also to JCI. Next slide. This is our standard minimum and substantive criteria. The evaluation committee was made up of our chief engineers and DOEs from a number of our sites, and someone from finance. Next slide. So this shows the equipment group and the vendor that was selected along with the equipment that they're maintaining. So Carrier was selected for equipment group 1. They were awarded a contract of $2.2 million, and they are maintaining all of the Carrier equipment. Next slide. Equipment group 2 was all of the York equipment, and equipment group 2 was the McQuay equipment. Group 5 was mix of multiple vendor equipment, and then number 4 was York equipment. JCI owns York and McQuay, and number 5, they were the lowest bidder. So all 3 of these equipment groups are put together in one contract, and they have a contract for about $5.5 million, including contingency and PM services. And last, next slide, is Train US. They were selected for equipment group 3 for a contract of $1.8 million, which includes PM and contingency for all of the train equipment. Next slide. This is the contract. So the contract will begin in April 1st of 2024 for 3 base years with 2 1 years. Carrier is the current incumbent for this contract. They have a rating of good. JCI is our current BMS vendor, and we use them for other repair services related to their equipment. They have a good rating as well. And Train also is used for their equipment, and they have an excellent rating. All 3 vendors were requested an MWBE waiver. Our vendor diversity team worked with them. Train and Carrier were granted that waiver since they're primarily responsible for their equipment and will be self-performing all of the work and the parts. JCI requested a 20% waiver, and they are achieving or set a 10% goal based on the mix of equipment that they have of various vendors. They're able to work with sub-consultants and also procure parts for those equipments outside of their company. And next slide, or the vendor performance slide. As I mentioned, JCI was good, Carrier was good, and Train was excellent. And the budget slide shows you the 3 contracts. Carrier for a total of $2.2 million, JCI for a total of $5.5, and Train for a total of $1.8. And the last slide is the request. Thank you, and happy to take any questions.
Any questions on these 3 resolutions? So let me move to a vote then. So the first one is the contract with Carrier. All in favor, please say yes.
Yes.
Opposed, say no. The next one is the contract with Johnson Controls. All in favor, please say yes.
Yes.
Opposed, say no. And the third one is the resolution on the contract for Train US. All in favor, please say yes. Opposed, say no. So the 3 resolutions approved. Thank you. And then the next 2 also go together.
Thank you once again. So these will be two resolutions in this one presentation. This is authorizing New York City Health and Hospitals Corporation to increase the funding by $5 million to its previously negotiated and executed requirement contracts for 7 architectural and engineering firms listed in here. Architectural Preservation Studios, H2M Architects, Hoffman Architects, Lothrop Architects, Ronnet Riley Architects, Superstructures Engineering and Architects, Urban Architects to provide professional A&E design services related to the exterior envelope projects on an as-needed basis at various facilities throughout the corporation. The cumulative not to exceed value for services provided by all such consultants shall increase from 10 million to 15 million. That's in the first resolution. The second resolution is authorizing New York City Health and Hospitals Corporation to execute requirement contracts with 8 architectural and engineering firms, consulting firms, namely Architectural Preservation Studios, H2M Architects, Land Survey and Landscaping Architects, DPC Liro Architects, Hoffman Architects and Engineering of New York, Lothrop Architects, Superstructures Engineering and Architects, Urban Architects, and Thornton Temensley to provide professional A&E services related to exterior envelope projects on an as-needed basis at various facilities throughout the system. The cumulative is not to exceed value for services provided by all such consultants, not to exceed $20 million. The contract effective date is January 1st of 2026 for an initial term of 3 years with 2 one-year renewal options. And with that, I'll hand it over to Erin Egan, our regional director for Capital Design and Development.
Manny, good morning. New York City Health and Hospitals, OFD, seeks to increase funding for the current contracts for professional architectural and engineering services for exterior envelope projects. These projects include, but is not limited to, facades, roofing, windows, and Local Law 11. The current pool is made up of 7 A&E firms listed below. Presently, the NTE amount is $10 million. Approximately $8.8 million has been committed to date. 88% of commitments are funded with city capital, 12% is expense funded. OFD seeks to extend the existing contracts for 1 year pursuant to the contract and increase the NTE amount by $5 million. Next slide. Here we have the current state, which is all of the current A&E firms and their amounts of the original contract awards, work issued to date, and their respective remaining balances. The 1 year extension and increase of $5 million will cover the new H&H financing plus bond projects as well as projected city capital. With that, I can open it up to questions, or we can hand it over to Menji and he can go through to the new contract. Go ahead, Menji.
Okay, thank you. While we're extending the value for the current pool, we also did a procurement for a new set of vendors. That procurement started in December of 2023. The RFP was posted to City Record and sent directly to 7 vendors. 47 vendors attended the pre-proposal conference. 27 proposals were received, and the evaluation committee went through multiple rounds of scoring, ultimately ending up with, I think it was 8 vendors for the new pool. Next slide. This is the normal, substantive, and minimum criteria. The evaluation committee were made up of a number of members from OFD, number of our Director of Capital Projects, AED, Smart Facilities, Finance, and EITS as well. Next slide. So, as I mentioned, we're seeking to enter into contract with 8 new contracts with vendors for exterior envelope services. Of the 8, the vendors with asterisks next to the name are currently in the old pool, and we'll have a new contract in the new pool as well. All vendors committed to a 30% MWBE goal. The anticipated start date of the new contract is January 1st, 2026, for an initial term of 3 years, with 2 one-year options for renewal. And the NTE value for the contract pool will be $20 million. Next slide. So these are the performance evaluations for all the vendors and their MWBE goals. One vendor, Hoffman, has a fair evaluation. The system was working closely with Hoffman, providing technical assistance, and we hope with that work that they will continue to improve their performance, and that will carry over to the new contract as well. The next slides are just all the ratings for the new vendors. We'll do that in the chart, followed by their MWBE goals, which, as I mentioned, all are at least 30%, some exceeding 30%. And then the last slide is the request. Happy to take any questions.
Any questions from committee members? take it for a vote. All in favor, please say yes.
Yes?
Opposed, say no. Actually, there are two resolutions, so I should just cue on that. So let me go back. The first one is to increase funding by 5 million to the previously negotiated and executed requirements contracts with 7A architectural and engineering consultant firms. So all in favor, please say yes.
Yes.
Opposed, say no. And then the second one was connected to requirement contracts with A&E consultant firms. All in favor, please say yes.
Yes.
Opposed, say no. So the two resolutions approved. Thank you so much. We now move to the Vice President's report.
Okay. Good morning once again. We're in the midst of a very busy fall for OFD. New York City Health and Hospitals Bellevue, the South Standpipe project is substantially complete, and we have started work on the anti-ligature project at Bellevue. The standpipe risers supply water to a portion of our fire sprinkler distribution system. Bellevue has 7 standpipe risers in total. The standpipe was in very much need of repair and needed to be replaced, needed repair and then needed to ultimately be replaced, which is part of our life safety systems there. The anti-ligature project will provide a safer environment for our patients, our inpatients, behavioral health. New York City Health and Hospitals Harlem, the wellness room for staff was completed and is in use. At Metropolitan, we are nearing substantial completion for the flood wall protection financed by FEMA, which will provide flood protection from surges up to 500-year flood plan once completed. South Brooklyn Health held a project kickoff celebration for integrated women's health with Brooklyn Borough President Antonio Reynoso. The space will improve access to high-quality mother-centered care by focusing the patient and family experience. At New York City Health and Hospitals Kings, the local law 11 work on the P building is nearing substantial completion, which would allow us to remove sidewalk sheds, which supports the Mayor's Get Sheds Down initiative. New York City Health and Hospitals Lincoln, we have begun work on our parking garage, a desperately needed project up there that will improve our parking structure for our patients and visitors. Due to challenges in the healthcare landscape with our community surrounding New York City Health and Bellevue and Kings, we are experiencing an increase in demand for emergency services and inpatient services at both sites. Anticipating this increase and the need to expand the capacity in our emergency department at both of these facilities, design work is on our way for projects to expand the ED capacity at both facilities. Both of these projects are critical for the system to ensure that we can continue to provide essential healthcare services at a high level and a safe environment for both of these communities. We will anticipate coming to the board in the calendar year of 2025 with construction contracts for both of these sites and projects. And with that, I'll be happy to take any questions.
Thank you. Any questions for Manny?
Great job, Eddie. Busy.
Yes, that summarizes basically what I was going to say.
Mandy,
Anyway.
can I tell them that the dashboard indicator we use for the state of facilities in health and hospitals? Sure. We've developed a dashboard that's based on the number of nights Manny is woken up.
Oh, okay.
We range from, right now from 2 to 7. We think a good week, averages 3. If they only wake him up 3 times in the middle of the night, we're having a good week. So we'll send you out copies of the most current dashboard so you can track, the number of hours of REM sleep Manny loses in keeping our facilities together.
Thank you, Manny. We appreciate you.
But thank you for all your support. That trend is on a downward direction.
Thank you, Manny. So is there any old or new business to come before the committee? Hearing none, the meeting is adjourned. Thank you so much.
Thank you. Have a great day.
This meeting is no longer being recorded.